Can I tell you a quick funny story? Kind of typical Ryan. I think it was about 9. I was cooking dinner, and David saw Ryan kind of cowering in the living room, and he said, "Ryan, what's wrong?" And he said, "I swallowed a magnet." And he's like, "You have to go tell Mom." And his story was that he had thrown them up in the air, and somehow one of them got in his mouth and he swallowed it, which I still don't believe. I said to him, "We'll have to go to the hospital, I'll go with you. And we just want to see if it's in your lungs or in your stomach or, you know, where it is. And we'll see if we can get it out." And he goes, "I know exactly where it is." And I said, "What do you mean?" And he said, "It's right here." And he had the other magnet, and he stuck it right on his belly button and lifted his shirt up. I have a picture of Ryan with his shirt up with a magnet sticking to his belly button. And all the x-rays, he finally had to have a procedure to get it out. But all the kids called him Magnet Boy for years because of that, and he just loved telling that story. It was just typical that Ryan would do something like that. So that's how I like to remember him, getting home runs and swallowing magnets.
I met Tina and David Attride while researching the issue of suicide in our community. Every day, we here at NBC 10 and Telemundo 62 hear reports of suicides and suicide attempts from across the area. The numbers are alarming, and it's not a topic often talked about in the news. So we felt that we had to do something. But what remained the question? After speaking with parents like Tina and David, and suicide attempt survivors, experts, and activists over the past 5 months, we quickly learned that the most powerful thing that could be done to stop suicide was to talk about suicide. So we're doing just that. In this show, you'll hear some of the moving and inspirational stories that people shared with myself and my NBC 10 and Telemundo 62 colleagues, Rosemary Connors, Alicia Lozano, Denise Nakano, and Iris Delgado. And, most importantly, we'll offer solutions and suggestions for confronting suicide in your life and your community. Now, we know that this topic isn't easy, but this type of effort can save lives. We're breaking our silence on suicide. And now, let us show you why you should break yours. Ryan Attride took his life last February. The Holy Ghost Prep Jr. from Bucks County was 16. Ryan was a bright star, an athlete, had lots of friends, and was always quick to make someone laugh.
I always told Ryan that he had the hardest job in our family because he was the big brother and the little brother. And he really was kind of the glue.
His parents, Tina and David, both medical professionals, were blindsided by his suicide. But the reality is, suicide is the second leading cause of death for young people.
One day he went to school. After school he went to work. And after he came home from work he wanted to go out and ride his bike for a little while. And he didn't come home. So we got worried and started texting and calling him and got no answer. So David went to go look for him, and I continued to try to call and text him, and David found him.
I called the police, and still hoping that they could perform CPR, and became apparent pretty quickly when the officer came that it was over.
Talking about suicide sometimes means not talking about suicide. How Ryan chose to end his life isn't significant, and may be dangerous or even a trigger for others who may be in crisis right now.
We were a family who talked about suicide. We had a nephew who 4 years ago died by suicide when he was 20. And because of that and because of our jobs, we were very open with talking about things like drug and alcohol and sex and anxiety and depression and suicide. We thought we address those things. Not perfect parents by any means, but we felt like we were open to that sort of thing, and that our kids knew that if they were struggling, that they could come to us.
It pains me to say it, much as I'm trying to, in a sense, accept his decision, it was a terrible mistake. Whatever it was he was struggling with that night, it would have gone away. It wasn't the end of the world. No one could be expected to deal with. We'd know what it was. We'd have heard about it. A friend would have told us, or we'd have found out some way. There was nothing going on that people don't deal with, that he couldn't have dealt with support, with time. And it's just obviously the saddest thing to us that whatever it was, whatever sort of perfect storm of feelings and thoughts and events, whatever it was in his life that made him decide that was the night that he was going to do this. Like I said, it was a mistake in the sense that he could have. We know as adults that he could have gotten through it, and he could have got to the other side. We've all been through things. On the other hand, in terms of accepting it, I try to recognize how tremendously in pain and in distress he must have been. That must have been so strong, even though we don't know why. That must have been so strong to be intolerable.
Ryan and his cousin Stephen are part of a worrisome trend. Suicides are currently the second leading cause of death for teens and young professionals. Most are believed to have dealt with some mental distress, like depression or bipolar disorder, sometimes diagnosed, other times not. Overall, more than 44,000 people died by suicide in 2015, the most recent data available. More than car crashes and homicides. Even more staggering, though, the number of people who attempt suicide in the United States each year, 1.1 million. That's just shy of Philadelphia's population. How many of those people could you know? Safe to say there's someone in your life who is silent about their pain. But there are likely warning signs, like withdrawing, giving things away, saying goodbye. While middle-aged men are most vulnerable to suicide, recent increases among young people have some experts scrambling to explain the rise.
The increased rates of suicide attempts among kids in the 10 to 14-year-old age group is alarming.
Dr. Tammy Benton is psychiatrist-in-chief at the Children's Hospital of Philadelphia and is part of Philadelphia's Suicide Prevention Task Force.
I think stressors for kids have changed in terms of expectations about the future. I at times hear 11-year-olds and 12-year-olds say to me that if I don't get straight A's in 7th grade, I'm not going to get into AP courses in 9th grade. If I don't get into AP courses in 9th grade, I'm not going to get into a good college. If I don't get into a good college, I'm going to be homeless. For children in that age range, abstract thinking and long-term planning is not the skills that they've mastered. So they catastrophize those things. They become more anxious.
For Northeast Philadelphia native and suicide attempt survivor Amanda Giancola, that was very much the case.
My grades weren't good enough. I very much try and be a perfectionist. So when I don't amount to what I think I should amount to, it takes like a toll on me, and I just have that voice in my head telling me, like, you're not good enough.
Bullying over the way she looked added another level of stress for Amanda's time in grade school and high school.
I remember being in 8th grade and eating lunch in the classroom with one person. So I didn't have to go down to the cafeteria and sit with everyone.
Bullying now, extends beyond just some confrontation with a kid at school. For kids who are struggling with their sexual identities, not being able to be open or being teased or scapegoated by others because you're going through those experiences are also pretty stressful for kids. And those things now aren't necessarily localized to a small group, but social media makes it possible for it to reach so many more people. We call mental health disorders the same thing as we call feelings. So depression is how you feel, and depression is a disorder. There's not many things in medicine where that's in fact the case. It feels more like a judgment than a real illness.
That worry about being judged forces people, especially young adults who are still developing socially, to hide their distress. A fact 27-year-old Jordan Burnham from Audubon, Montgomery County knows well. Jordan attempted suicide when he was in high school.
I always had a mask on my face, acting like I was really happy, that I was bubbly, that everything was perfectly fine. When I was diagnosed with depression, I just took that as a label, meaning no one's going to want to talk to me, no one's going to believe me, since I was that person that was always smiling and always happy.
9 years ago, feeling trapped and alone despite undergoing treatment for his depression and having support from his parents, Jordan, then 18, attempted to end his life following an argument at his family's Upper Merion home. He describes the decision as impulsive. We're sharing the way Jordan attempted suicide, called the means, because he speaks publicly about it.
I attempted to take my own life by going out of my 9-story bedroom window, devastating injuries. Woke up in this hospital not knowing why I was there. My sister told me what happened. When she said the 9-story fall, that's the part where I just couldn't get over that. I could not accept falling 100 feet and surviving that. And that's where I thought maybe she's exaggerating, maybe she's lying. Maybe I attempted suicide, but it couldn't have been out of my window, even though that was the only thing that logically made sense. Because the only thing that I remember is hitting the ground and a helicopter ride. Those are the only two things that I actually remember.
Shattered, unable to physically speak but alive, Jordan began his arduous recovery, not only through surgery and physical therapy, but emotionally by sharing his story. He agreed to an interview with a reporter from the Philadelphia Inquirer.
I can't move, I can't talk. I have no idea if I'll ever get my physical life back. But I figured that by literally spelling out every single word of that interview on an alphabet chart, people on the outside of the hospital can touch the words I don't have a voice to say. So whoever read that article, whoever heard about my story, was never in the position that I was at laying in that hospital bed.
From that first public admission, Jordan began sharing his lived experience with suicide with teens and middle schoolers. The hope? That it chips away at the stigma of suicide, so they ask for help when they need it most.
If there's one thing that maybe could have, prevented my suicide attempt from happening, it was probably, I could have been open and communicating when I was at that low place. That last week or two, I wish I'd been able to just talk to my therapist about it and be honest. And that's something that really hindered me keeping it inside.
While Jordan realizes now speaking up could have diverted him from suicide, how do you help younger children who are still learning how to be a kid? Kirsten Killian first attempted suicide when she was 9. Her mother, Ashley, was terrified.
At age 9, it's hard to even comprehend that a child would know what suicide is at that point, to know that they would want to end their life. I struggled immensely with that, not knowing how to help her. I was always afraid to leave her alone after that. I never wanted to yell or discipline because I didn't know what was going to bring on that next fit.
Ever since that day 6 years ago, Ashley has been struggling to get Kirsten quality mental health care, but it's not easy.
When you try and find a psychiatrist, you have to drive 2 hours away, or you have to pull them from school to go, or they don't take your insurance, so you're paying a couple $100 a session. Not many people can afford that. They would have to push it off, and then you feel like you're failing your child because you can't get them the help that they need.
Things got better for a while. Then a year ago, the Lancaster County Teens Depression took over. She was getting some therapy through school and was taking medication, but it wasn't enough.
I got to the point where I had found a broken picture frame, and I asked her about it because she had asked me for a Band-Aid because she cut herself. And I got her a Band-Aid and helped her get that cleaned up, but that was just to find out that she had intentionally broken the picture frame to cut herself.
They went to the hospital for help, but Ashley says doctors brushed the incident off. A few weeks later, Kirsten attempted to take her life.
She had gotten into an argument with my husband and decided that right then and there she was just done. She didn't want to fight anymore. She didn't want to deal with anything that was going on. It's probably about 45 minutes later that she had come crying to me, telling me she needed to tell me something. And every day I'm so grateful that she did.
I realized that there was much, much more to life than just my sadness and what I was going through.
Kirsten's doing well now. The thought of what could have been angers Ashley.
It took Kirsten 2 times trying to kill herself to get actual help, like actual help. And that's kind of scary. We had met with our family doctor before the attempt, and even then I was just told it's just her hormones. She's dealing with all kinds of teenage things. It's not anything to worry about. But then when you go back and you're like, look, this happened, they kind of make you feel like you didn't do everything you should have done, even though you know you asked, you tried to advocate for your child, and it kind of falls on deaf ears.
Ashley's frustrations with poor mental health care are not uncommon.
When you get your insurance, it's typically 2 different providers. There's your medical provider and your mental health provider. It's possible your insurance covers your medical care, but it doesn't cover your mental health care. What we're doing here at CHOP and many other places is we're trying to integrate care so that we're working to embed mental health providers in their pediatric practices so families don't have to go out looking for help, and sort of create an environment where it feels more like you're just getting your medical treatment for a medical condition, which is what it actually is.
The common separation between the 2 types of healthcare silences the very people who need help most. Attorney Susan Steffen heard it time and time again over her 30 years defending clients with mental illness. She also wrote a book about suicide law and policy.
People longed to talk to me and tell me their stories, and they wanted to be heard without having to be scared of being sent to a mental hospital, without having to be scared of losing custody of their children, without having to be scared of losing their jobs, without having to be scared of losing access to insurance. In this society, we punish people for revealing that they're suicidal in so many ways.
Steffen believes there needs to be policy changes to move the focus from acute care dealing only with the crisis to a public health approach. It's promoting good mental health and prevention efforts, a direction that's typically less costly, but takes time to see results. One aspect Steffen suggests is limiting liability for mental health professionals.
In our society, we don't live with oncologists who say, your cancer is just too severe, you're a stage 4, so I'm not going to treat you. But we do live in a society where mental health professionals say, you are too acutely suicidal, I am not going to treat you. On the other hand, oncologists don't get sued when their cancer patients die, and mental health professionals, I believe inappropriately, often get sued.
Steffen says there's a need for changing the type of care offered, moving to community care, understanding that we all have a role to play, teaching coping skills, and letting suicidal people share their feelings without fear of being locked away.
You could lock somebody naked in a cage and stop them from killing themselves, and we wouldn't think we had succeeded. And yet, people believe that the most important thing you can do if somebody says they want to die is stick them in an ambulance or handcuffed in the back of a police car, take them to an emergency department that is loud and hurried where they wait for 15 or 16 hours. This is somebody who has just said they are so miserable they want to die, rather than take the time to sit down and have a long conversation about how can we make your life worth living? What are the changes you need to see to make your life worth living? Those changes are going to take time. And we are a society that is addicted to short-term solutions, and they don't work. When people are so miserable they want to die, there is no quick fix.
Every day I wear his bracelet, has his name, Anthony. It was his bracelet. And this is the life preserver pin, and in the center is actually my son's birthstone. It's a way for me to always keep him with me in the work that I do. He's my first thought in the morning, my last thought at night.
Anthony Siciliano's suicide crushed his mother's world. Kathy and Anthony were close. They talked nearly every day, including the day he died.
Anthony was amazing. Anthony lived life, as someone once wrote to me in a sympathy card, with such exuberance and enthusiasm, more in his 26 years of life than some people experience in a lifetime. He was a volunteer firefighter with the Huntington Valley Fire Department. He was actually on the waiting list for the Philadelphia Fire Department. He was trained in the jaws of life, hazmat, like any certification that he could possibly get a hold of, he was certified in. He wanted to give. I didn't see the highs and the lows. Anthony, whenever he presented, he was always high. And if he had those lows, he hid them. He hid the pain. I can't wrap my mind around the fact that he talked to me about everything in life, but this one dark secret he couldn't share.
And that's why we love him so much.
Kathy shares Anthony's story once a month with others impacted by suicide.
Suicide is an irrational act, and we sit here with rational minds and try to wrap a rational mind around that, and it's impossible. I facilitate a support group for suicide loss, and I've been doing it for about 8 years. It's called Life Resurrected. It's at St. Albert the Great Church in Huntington Valley, and it gives people a place to come and share their grief.
I like to come because I hope that maybe I can be some comfort.
Families are torn apart by this grief and this chaos. So it's really important to create a safe environment where these families can come and share what they're going through. This is not a grief that you can suppress. This is not a grief that should be pushed down. This is a grief that really needs to be dealt with because it's a very complicated grief. And that's probably the most important thing about the support group, is that it's a safe environment and that it remains a safe environment for all the survivors that come. People will experience grief differently, and then we have society trying to define our grief or telling us how long our grief should last. What I've come to find in suicide grief is the most important thing that you can hold on to is peace.
After Anthony's death, Kathy got involved with the American Foundation for Suicide Prevention, known as AFSP, helping to run the Philadelphia chapter, one of the nation's largest, planning fundraisers and the annual Out of the Darkness Walk.
It is because of you we are turning the tide on suicide statistics. We are going to support those who have been touched by the tragedy of suicide and also those who struggle. We are the Philadelphia family. It started out with 649 walkers, and we raised $75,000. And this past year we had over 7,000 walkers, and we raised $550,000. You know, a lot of people have a hard time thinking about the walk when you say, well, there's a walk for suicide. Well, there's a lot of people that have survived suicide, that they're still living today. They have lived experience, and we celebrate that they're with us. The camaraderie of people getting together and lifting each other up from a loss that is just so devastating. And it's healing for those who have lost someone because they're surrounded by so many other people that know their loss and understand their loss. I want to see this walk go away. I want to see AFSP not have needs staff. Will that ever happen? I don't think that we'll eradicate suicide, but these statistics are not something that we should be complacent with or be willing to live with. This was a kid that wanted to change the world. And although he's not here to do it in person, he's doing it through me. I would give anything in the world to have my son back, but I wouldn't change who I become because of that loss.
Technology is providing an alternative for people who are afraid to have in-person conversations about their struggles. The Crisis text line does no advertising, no formal outreach except for social media, but has handled more than 33 million messages in 3 years. Anyone, anywhere can anonymously reach out for support.
We don't define it further than that. We don't say like, this is okay as a crisis, this isn't. It's up to you. I mean, if you feel like, getting a D on your calculus exam was a crisis and you're really cut up about it, like, contact us. And if your crisis is sort of more imminent and personal risk than that, contact us. We call it crisis text line, and it's up to you to define what that means, and we're here for you. And we're never going to turn anybody away and say, this is not important. If it's important to you, it's important to us.
The New York City-based service acts like a tech startup, and they use the data they compile to help respond quicker. They can prioritize conversations based on what a user says, and using an algorithm, suggest questions to counselors so they get to the root of the issue more quickly. Counselors are all volunteers from all around the world. Lublin says they are in the business of providing empathy.
I know that what we're doing here really matters, and that we've de-escalated a lot of situations. We've helped a lot of people remember how strong they are in crisis moments. We've helped nudge people to a path that's safe. And it's strangers, helping other strangers. 65% of people who text us tell us that they've shared something with us they've never shared with anyone else before. This is a safe space to share those things. And I'm proud of that, and I'm also super bummed, because it should be okay to share these things with your family, with your friends.
Because people, especially youth, may not be given the opportunity to speak freely about their struggles, researchers see the need to offer alternative ways for identifying those in crisis. And that can be done with something as simple as a questionnaire. The Behavioral Health Work Survey may have diverted hundreds of young people from heading towards suicide. Developed by 2 Philly docs and implemented a decade ago at the Children's Hospital of Philadelphia, the 6 to 10 minute digital survey asks about a range of issues like sexual health and mental health. Drexel University's Dr. Guy Diamond helped create the survey.
They found kids coming in with a cold, with bronchitis. They gave the survey, and kids would report depression, suicide, trauma histories, remarkable things that they just never thought about asking about. And you give the screen, and kids are saying, there's problems at home, and I don't have anybody to go to.
Between 300 and 400 young people are screened in the CHOP ER every month. Buoyed by its success, the survey has expanded to other places, like primary care doctors' offices, often a place lacking important mental health screenings. Some schools have begun screening students too, with great results.
We were working with a school in central PA. They thought, let's give it a try. We'll do 30 kids. They did 30 kids. 2 of them reported severe enough ideation that they ended up going to the hospital. Out of the 30, the school was just floored.
The survey results show the need to have open discussions with young people about mental health, not just as teens, but at much earlier ages. Parents and teachers need to be willing to ask questions. Are you thinking about hurting yourself? Are you suicidal? And be prepared for the answer. People who are feeling suicidal can find the simple questions liberating. For young people who are suicidal, preventing the attempt is key. Having a strong family bond can make all the difference. Dr. Diamond and his team offer an outpatient therapy that aims to rebuild bonds that have been broken.
For us, the center of our therapy is when you're upstairs and you're hurting and you're thinking about taking these pills and your parents are downstairs watching television, why don't you go to them? What's happened to that instinctual desire to have parents protect you like when you were a kid?
They teach kids to seek out their parents when they're feeling suicidal, and parents to better respond to their child's needs. The family therapy is offered for free through Diamond's clinic at Drexel. And he's continuing to do research on the therapy to hopefully expand its use into colleges. The question at the heart of this is, what drives a person to suicide? Some point to a mental health condition, others to extreme stress or a bad life event like losing a job or a breakup. Increasingly, there's a focus on biological links among family. Penn's Dr. Maria Oquendo is studying these connections.
People often think about suicide as a catastrophic reaction to something bad that happened to a person, but it's very clear that people have a biological vulnerability to this behavior, and it runs in families.
So this is a picture of my dad that I had attached to my wedding bouquet since he wasn't there to walk me down the aisle. And I have this hanging with me in the kitchen all the time. It was funny, I knew that this was going to be on the bouquet. I had it made. I sent it to the florist. I knew it was going to be there. And then, the flowers were delivered to the venue. And I get there and I'm handing my girls their flowers and I see this and I lost it. I was bawling my eyes out. I'm like, I knew it was there. Why am I crying? It was just so touching because he was there, like it did now.
Kelly Bowie's father, Walter Rogers, died by suicide 20 years ago. It wasn't until after his death that Kelly learned Walter's dad, Tom, also took his life.
It was surreal. I didn't believe it. Like, how could he do that? Especially because he knows what it's like to be left behind. Like, I think about that now. He went through it. You know, his father died by suicide, and he was in the next room. He found him. He heard it.
A depression and PTSD diagnosis followed for Kelly in the years after Walter's death. At one point, she became suicidal.
It was just an emptiness. I just felt like I was going to die. It was the weirdest thing. I would, like I said, I'd be driving, and I would envision myself driving off the side of the road. It wasn't something I wanted. It was just these visions would pop into my head, and I would get so, like, angry. It's so scary that you think that it really can run down the family line. The mental illness can be so, not so bad, but so untreated or so hush-hush that, you know, this can happen in the blink of an eye. I seek therapy when I need it. I take medicine when I need it. I have a beautiful daughter to live for, so I don't think I would.
One of the things that I would like to see is families starting to talk about this. Just like you tell your kids, hey, breast cancer runs in the family, or you tell your kid, hey, heart disease, or whatever, that if suicide runs in the family, we have to talk about it. Because our kids need to know, if they start thinking about suicide, there's something wrong. It's like having a fever. You know, it means you're not well. And the kid has to be socialized to that.
Dr. Oquendo says more research needs to be funded to investigate these links and other issues surrounding suicide. While an American attempts to take their life every 29 seconds, research funding around suicide pales in comparison to other medical conditions. Federal funding for suicide totaled $37 million last year. That's 33 times less than heart disease, and 126 times less than cancer research. One research effort that's seen positive results with little money got its start in rural New Hampshire.
My name is Ralph D'Amico. After 4 years in the military, 1973, I went to work at Riley's Sport Shop in Hooksett, New Hampshire, and never left. Among responsible firearms owners, and dealers particularly, firearm safety is always paramount.
This has become pretty high-tech stuff.
6 years ago, I have a call from Elaine. She said, did you know that your business, your shop, sold guns in the period of 6 days to 3 individuals who took their lives? I was astonished. She said, let's get together and talk about this, and it started. We started the coalition.
The Gun Shop Project is run out of Harvard's Injury Control Research Center in Cambridge, Massachusetts. It provides gun sellers gatekeeper training to spot potential suicidal behavior, as well as suicide prevention material that can be distributed in stores.
Firearms are the leading cause of suicide, far more effective than pills and any other method of taking one's life.
What we're just trying to do is to just say, add the thought of suicide to the things that are going through your mind when you're talking to someone about purchasing a firearm.
The gun shop seemed to be a trusted place to get information about, hey, what should become one of the basic tenets of firearm safety is to be alert to signs of suicide.
Our first effort was a poster, very mild legislation to post these posters in gun shops.
What we're saying is to people here is if you have a relative or a friend who's distressed and may be in danger of taking his or her life, go to them, be an advocate for them, and safeguard their guns.
Principle is you put time and distance between the lethal means and the individual, and most of the time the situation goes away.
And one of the things is trying to spread the message beyond the gun shop using firearm instructors who are teaching classes on safety and trying to get them to introduce the concept of suicide prevention as one of the things you should be looking at.
So it's not about you shouldn't be a gun owner, guns are bad. It's not about any of that. It's just about for now, while you're struggling, I'd feel safer for you if the guns could be out.
It's not a them project, it's a you project. You know, you need to be aware of Uncle Joe, you know, who's having a tough time, or your brother who's having a tough time, and get involved. You know, don't be skittish about this. This is, you know, not for the faint of heart. You need to get in there and do something.
Means reduction has worked in the past. When gas poisoning was a top method for suicide in Britain, the government changed how homes were heated, and suicides dropped. The same happened in Southeast Asia, where people were ingesting pesticides to kill themselves. The chemicals were restricted, and the suicide rates went down. The Gunshot Project is now in 21 states. It has not been adopted by sellers in Pennsylvania, New Jersey, or Delaware yet, presenting an opportunity. One perhaps untapped resource in the effort to reduce suicides and suicide attempts are the people with lived experience, the preferred term for someone who attempts suicide. Desiree Stage is giving them a voice. The 33-year-old who lives in Philadelphia's Fishtown neighborhood created the project Live Through This. Through photos in their own words, Desiree documents attempt survivors' lived experience for the world to see and hear.
I'm saying, hey, just tell me your story. I want to hear what you've got to say. And let's show the people your face. Let's tell them your name. Let's let them know that you are real. And oftentimes, when they are a part of Live Through This, it's the first time they've shared their story. I was 23 years old. I lived in Johnson City, Tennessee. I had just graduated with my bachelor's degree in psychology. I'd been accepted into a PhD program. You know, suicide is an extremely complex thing, but after struggling with the thoughts for 2 years, it was just that was the day that I had made my decision. I was in the hospital for a total of 3 hours, and I found my discharge papers recently. It said follow up in 24 hours, and the phone number that it gave me for follow up was 000000000. I can't imagine somebody who felt like they wanted to go that route in finding help, and seeing that number. I can't imagine what that must feel like. I promised myself that day that I would stop hurting myself and that I would change whatever needed to be changed. I figured I could do with my camera what I couldn't do with science, and I immediately returned to this idea of suicide. And I knew that there were plenty of us. I knew I wasn't the only one. I just didn't really know why no one would talk about it. These portraits that I make are all about the eyes, because you can see so much about a person in their eyes. They say, God, I feel like a weight has been lifted from me. I feel like I've been heard for the first time. I feel less ashamed now. A lot of pain can be diffused just by listening. A lot of that crisis can be diffused just by listening and asking, are you suicidal? How can I help? What can I do? It's a good record of a moment in time. And someone told me yesterday, I think it was, that they can look back at their story and at their portrait and go, okay, I felt like this then, and now I feel like this now. And oftentimes they feel better than they did. That it's a measure of healing, in a way. A majority of research around suicide has definitely focused on people who have died. With anything else, you would ask an expert. People with lived experience are experts on their own lives and their own experiences. We focus so much on how do we prevent suicide, all the bad things surrounding it, the risk factors. We never focus on post-traumatic growth. What did you learn from this traumatic experience in your life? And I think that is something we should really be focusing on, because the goal is zero suicide, but the suicide rates have been rising for 2 or 3 decades now. And so what do you do while you're working on that zero suicide goal?
Live Through This has gained nationwide attention. Since its inception in 2011, Desiree interviewed 180 attempt survivors in 33 cities. She recently put on a gallery show in Philadelphia, the largest public display of her portraits since the project's start. The work has been so impactful, Desiree was recently honored by the American Association of Suicidology. Live Through This also won a grant to expand the effort.
You know, people are going to go through really awful things. Every single person will go through something awful over the course of their life, and they're going to need support. And a lot of people somehow just don't know how to do that. I do what I love every day. I am my own boss. I'm married to a perfect human being. I have 2 dogs and 2 cats. I own a house. I have things I never thought I could have. And I have amazing friends. I have everything. But that doesn't mean that I don't struggle. I do still have suicidal thoughts. I do still want to hurt myself sometimes. I think it's pretty incredible that I've lived, and not only have I lived, I've gotten to experience so much more than a teenage me would ever believe. And I'm not doing anything special. Nothing about what I do is novel or unique other than the population that I do it with. People just want to be heard.
It's been 3 months since I met Desiree, and the most powerful thing that I learned from her is we all need to help other people to stay. You saw it on her shirt. There's no reason why we should have so many people attempting suicide or dying by suicide every year. Suicide is obviously a complex topic, and there's no one fix or strategy that will help bring those numbers to 0. Still, there are a lot of simple things that you can do to help.
Talk. In school, at church, in your home, have frank discussions about suicide with the people you care about. Ask direct questions about how they're feeling, offer them support, and be prepared to listen.
Look for signs of distress. Are they withdrawing? Are they giving things away? Are they saying goodbye? If someone is in distress, don't leave them alone. Call the National Suicide Prevention Lifeline or text the crisis text line.
Don't judge someone who's in crisis or has a mental health issue. Just because you don't see the injury doesn't mean it doesn't exist.
Change your language. Make a pledge not to use phrases like, she's crazy, or commit suicide, which suggests a suicide is a crime.
Mental health and physical health are equally important. Treat them the same. Find healthy ways to deal with stress.
Speak up. If you know someone who is in crisis, tell a professional. If you attempted suicide or lost someone to suicide, share that story to break the stigma.
Understand no one is immune. All ages, races, and classes are affected.
For those struggling, know that you can get through it. Know that there is help and that there is a tomorrow.
To help you better understand this topic, we have an extensive section on NBC10.com and Telemundo62.com. Written stories, more video testimonials, plus resources like a mental health screening tool providing local care options, and a place for you to break your silence on suicide. Don't let suicide be a dirty word any longer. Break the silence, step into the light, save a life, stay. Thank you for joining us.